What is TheraTears Nutrition? TheraTears Nutrition is an oral omega-3 supplement that supports eye comfort and healthy tears. The ingredients in TheraTears Nutrition include fish oil and organic flaxseed oil for their omega-3 content, and vitamin E, which acts as an antioxidant. Essential fatty acids, EFAs, are lipids that cannot be made by our body and have to be obtained from our diet and include fats such as omega-3. EFAs are used by the oil glands in our eyelids to make the oily layer of tear film. TheraTears Nutrition provides omega-3 EFAs that may be used by our oil glands to make good quality tears. Tear film is made up of 3 layers: an oil layer, a water layer and a mucin layer, helps the tears to stick to the surface of the eye and provides the underlying cornea with nourishment. Tears are vital for the health of our eye and our vision. Without sufficient good quality tears, our eyes are at increased risk for infection and damage from foreign particles. Dry eye is a condition that results from poor quality tears. TheraTears Nutrition is recommended for eye conditions such as dry eye. TheraTears Nutrition also supports oral health, because the salivary gland and tear glands work in a similar way. The omega-3s in TheraTears Nutrition help with the production of healthy saliva and help with the maintenance of good oral health. Important information. Take TheraTears Nutrition exactly as directed on the label, or as prescribed by your doctor. Do not take it in larger amounts or for longer than recommended. TheraTears Nutrition should not be used in patients with a fish or soy allergy. Soybean oil is used as a carrier for vitamin E, another ingredient in TheraTears Nutrition. People with coagulopathy or taking anticoagulants or other medications should notify their physician prior to taking dietary supplements, including TheraTears Nutrition. Stop taking TheraTears Nutrition at least 2 weeks prior to any scheduled surgery or procedure. Swallow the TheraTears Nutrition capsule whole. Do not puncture or open the capsule. Marine oils like TheraTears Nutrition help support eye function but are only part of a complete program of eye care that may include proper eye cleansing and lubricating eye drops. There may be other drugs that can interact with TheraTears Nutrition. Tell your doctor about all medications you use. This includes prescription, over-the-counter, vitamin, and herbal products. Do not start a new medication without telling your doctor. Stop using TheraTears Nutrition and get emergency medical help if you think you have used too much medicine, or if you have any of these signs of an allergic reaction: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Less serious side effects are more likely, and you may have none at all. Talk to your doctor about any side effect that seems unusual or is especially bothersome. The omega-3s in TheraTears Nutrition are derived from highly refined fish oil obtained from anchovies and organic flaxseed oil. These sources are likely to have lower levels of contaminants and toxins than other sources of fish oil such as marlin, tuna, or swordfish. Before taking TheraTears Nutrition, do not use marine oil such as TheraTears Nutrition if you are allergic to fish, other types of seafood, or soy. Be sure to check the label on the TheraTears Nutrition package to look for other active or inactive ingredients that may cause an allergy. If you are not sure, ask your pharmacist. Ask a doctor or pharmacist about using this medicine if you have diabetes, liver disease, a pancreatic disorder, a blood clotting disorder or risk of stroke, upcoming surgery or procedure that might increase your risk for bleeding, an underactive thyroid. Drink more than 2 alcoholic beverages per day. It is not known whether TheraTears Nutrition will harm an unborn baby, although certain prescription omega-3 fatty acids, such as Lovasa, have a pregnancy rating C. Tell your doctor if you are pregnant or plan to become pregnant while using TheraTears Nutrition. It is not known whether omega-3 polyunsaturated fatty acids pass into breast milk or could harm a nursing baby. Do not use TheraTears Nutrition without telling your doctor if you are breastfeeding a baby. Do not give this medication to anyone under 18 years old. See also, Omega-3 polyunsaturated fatty acids, pregnancy and breastfeeding. How should I take TheraTears Nutrition? TheraTears Nutrition is available as an easy-to-swallow soft gel. The recommended dosage is 3 capsules in the morning. Do not take more or less TheraTears Nutrition without first consulting your doctor. 3 capsules of TheraTears Nutrition contain EPA 450 mg, DHA 300 mg, ALA 450 mg, VT 183 IU. Swallow TheraTears Nutrition capsules whole. Do not puncture or open the capsule. Store TheraTears Nutrition at room temperature away from moisture and heat. Do not freeze. What happens if I miss a dose? Take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make up the missed dose. What happens if I overdose? Seek emergency medical attention or call the poison helpline at 1-800-222-1222. What are the side effects of TheraTears Nutrition? Get emergency medical help if you have any of these signs of an allergic reaction to TheraTears Nutrition: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Stop using TheraTears Nutrition and call your doctor at once if you have any of these serious side effects: fever, chills, body aches, flu symptoms, chest pain, irregular heartbeats. Less serious TheraTears Nutrition side effects may include bad breath, bloating, fishy aftertaste or belching in some patients, heartburn, nausea or an upset stomach, loose stools. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA 1088. What other drugs affect TheraTears Nutrition? Talk with your health provider before taking TheraTears Nutrition. TheraTears Nutrition may interact with the following medications: anticoagulants, blood thinners, or medications that slow blood clotting, such as aspirin, clopidogrel, diclofenac, ibuprofen, heparin, warfarin. Fish oil can also slow blood clotting. Diabetes medications for diabetes, such as insulin, glimepiride, glyburide. Fish oil may also lower blood sugar levels. Monitor blood sugar levels closely. Orlistat may decrease the absorption of fish oil when taken together. This list is not complete and other drugs may interact with TheraTears Nutrition. Tell your doctor about all medications you use. This includes prescription, over-the-counter, vitamin, and herbal products. Do not start a new medication without telling your doctor. How effective is TheraTears Nutrition? Studies have shown that a diet rich in fatty fish or omega-3s from fish oil capsules can reduce the risk of heart attacks and strokes. At least one small study found an improvement in dry eye symptoms after the use of either flaxseed or TheraTears Nutrition. No significant difference was found between flaxseed and TheraTears Nutrition, and the authors concluded that flaxseed oil capsules may be a less expensive alternative to TheraTears Nutrition. Your pharmacist or physician can provide more information about TheraTears Nutrition.